infections. Prevention. Some strains of the bacteria remain latent in the rabbit's nasal tract until the immune system is placed under stress, such as when a new diet or pet is introduced or if overcrowding occurs. Reducing stress for rabbits that are infected and the quarantine of new rabbits are good ways of preventing introduction of the disease or recurrence of signs. Treatment. Treatment involves a long and sometimes repeated course of antibiotics. Occasionally surgery is required if an abscess forms. 3. Hairballs, Trichobezoars. Cause and clinical signs. Hair can normally be found in a rabbit's stomach as they self-groom. However, as rabbits cannot vomit, hair must be able to pass through the gut. If it can't, then it will form an obstruction and serious complications. Hairballs are so common that they should always be considered as a problem in any rabbit that is lethargic and not eating. Prevention. Hairballs are more likely to become a problem if there is an issue with the gastrointestinal tract, gut stasis, or they are not receiving enough fiber in their diet, so a high fiber diet is a great preventative measure. Treatment. Sometimes surgery is the only treatment if the hairball causes a blockage in the gut. Medication to get the gut working again can also help. 4. Uterine Tumours Cause and clinical signs. Entire female rabbits can develop a cancer called uterine adenocarcinoma, and it should be suspected anytime an undesexed female rabbit becomes sick. Some of the more common clinical signs include blood-stained vaginal discharge, aggressive behavior, mammary gland cysts and lethargy. Prevention. These seen early at 4 to 6 months of age. Treatment. These seen, hopefully prior to the cancer spreading through the body. 5. Myxomatosis Cause and clinical signs. Myxomatosis is a virus that is transmitted by mosquitoes, fleas, or by close contact between an infected rabbit and a susceptible rabbit. The disease is recognized by swelling and discharge from the eyes, nose, and anogenital region. Prevention. Unfortunately, there is no vaccination available in Australia. Invest in a mosquito-proof rabbit hutch or bring your rabbit inside at dawn and dusk when mosquito levels are higher. Flea control can help, and when introducing new rabbits, keep them isolated for at least 2 weeks. Treatment. The disease is invariably fatal. 6. Rabbit Haemorrhagic Disease Virus, previously known as Rabbit Calicivirus. Cause and clinical signs. Rabbit Haemorrhagic Disease Virus, previously known as Rabbit Calicivirus, is spread by mosquitoes, flies and or through indirect contact or direct contact with an infected rabbit. There are currently 4 strains of RHDV virus: RHDV1, RHDVA, RHDV2 and RHDV1K5. Rabbit Haemorrhagic Disease Virus, RHDV1K5 was released nationally in the first week of March 2017. This virus was being released as a biocontrol measure to manage wild European rabbits. In most adult rabbits, the disease progresses rapidly from fever and lethargy to sudden death within 48 to 72 hours of infection. The incubation period for the RHDV is between 1 to 3 days. Most rabbits will show no signs of external symptoms of RHDV. The clinical signs include poor appetite, restlessness, lethargy, and fever. The disease causes acute liver damage with resultant blood clotting abnormalities. This disease can be fatal due to the obstruction of blood supply in vital organs and or internal hemorrhages. RHDV has a mortality rate of 70 to 90% in susceptible rabbits. Prevention. Vaccinating your rabbit will provide protection against RHDV1. From the limited research carried out, it would indicate that it does provide protection against RHDV1K5. May or may not provide protection against RHDVA and RHDV2, and not in every rabbit. Vaccinations are administered every 6 months for adult rabbits. Adult rabbits that are overdue for a vaccination or have not previously been vaccinated will need to be given 2 vaccinations, 1 month apart. Young rabbit kittens can be vaccinated from 4 weeks of age repeated monthly until 12 weeks of age and then every 6 months. We recommend along with vaccination. Preventing direct and indirect contact between domestic and wild rabbits. Avoid cutting grass and feeding it to rabbits if there is the risk of contamination from wild rabbits. Wash hands, with warm soapy water between handling rabbits. Good insect control is also important and will help reduce the risks of introduction of both Calicivirus and Myxomatosis. Insect control could include insect proofing the hutch and keeping rabbits indoors. We also recommend a monthly treatment with a topical biting insect preventative, but please talk to your vet about the correct dosage regime. Infected rabbits should be isolated with care taken to minimize environmental contamination.